Hello Malaysia and welcome to another edition of Medical Today. I'm Jared Ratnam. Now on today's show we've got some very interesting news for you with regards to dementia. If you didn't know what dementia is, we're going to walk you through that shortly. We're also going to give you a bit of a 101 on diabetes, or what's known scientifically as diabetes mellitus. That's coming up very, very soon. But for now, let's talk about pharmaceutical logistics to ensure safe delivery of medicines to the public. Of course, this segment is brought to you by Pharmaniaga. Now, Vinodini Chandrasegaran spoke to Abdul Malik Mohamed, the Director of Logistics and Distribution from Pharmaniaga Berhad. Let's take a look at this interview.
When the product being produced by the pharmaceutical manufacturer plant, it has its quality where it has been determined by the good manufacturing practice. Yeah? And the question here, how are we going to deliver or distribute this product to the consumer by having its quality being preserved safely and on time? This is the distribution process that we must look into and comply with the good distribution practice. In this highly regulated industry, where it requires safety and stability, movement from one product from one end to another end, it requires you to have a good infrastructure, good system and good management to manage it. So in other words, we have to follow the good distribution practice guidelines to manage this. So by having this, it is difficult for us to outsource such a core business to other party. So because there will be an adequate controls need to be put in to make sure that the delivery made throughout the distribution process are in orders. Okay, to have a logistics pharmaceutical facilities is to have where you need to have a good warehouse facilities in such a way that it can keep the products in accordance to their storage conditions, such as some products may require you to keep below 25 degrees Celsius, and some biologics may require you to keep within 2 degrees to 8 degrees Celsius. To ensure that we always follow the guidelines, the good distribution practice guidelines, we have two important parties that come and closely monitor our activities. Number one is from our internal auditor, from the regulatory department, and which they come and audit us frequently, and two will be on a yearly basis, will be audited by the authority by the name of National Pharmaceutical and Regulatory Agencies. We also incorporate the control mechanism in each of the processes, and all of this being tracked by the systems. So at any point of time, before it reaches to the maximum, so system will trigger and tell us to make sure that we complete this exercise and complete delivery on time. In the event there is an accident, we have a procedures to counter the damage, control, in a way that where we have a distributed warehouse nationwide. We have 5 locations in fact. So whenever the accident happens to the nearest place from the distribution center, so the team will get the information and reprocess the order made to the customers affected and will distribute from the nearest distribution center to the client. The delivery services, if you were to compare in Peninsula and also East Malaysia, there are much difference. In East Malaysia, we are facing a lot of, in a way, difficulty to reach at the remote area, where the mode of transport also there will be different mode of transport to reach there. There are occasions where we have to deliver right from our distribution center in Kuching, for example, to use the land and reach to the other area, about 600 kilometers, and from there we have to change mode of transport. Like to access that place, we have to use a long boat. So these are the challenges that we face, especially when it comes to delivery in East Malaysia, in compared to Peninsula, where Peninsula here, the access here are very fantastic, I would say, and within 4 hours we can reach to the destination without any problems. If the infrastructure is being improved at the other end or in East Malaysia, this can be solved actually by giving us the opportunity to access the customer much more faster with safety, and also deliver the products with the condition required as in the good distribution practice guidelines.
Anda sedang merancang untuk bercuti, jalan-jalan bersama keluarga? Saksikan program 1001 Destinasi Malaysiaku untuk paparan percutian yang boleh membantu anda memilih destinasi bercuti bersama keluarga dan taulan. Setiap hari Khamis pada pukul 8.30 malam di Bernama News Channel. Semuanya tentang anda.
Mengaut keuntungan secara haram. Pendapatan nelayan tempatan terjejas, musnah ekosistem negara.
Hey! Masuk nelayan asing, pendapatan kita sekarang semakin merusuk.
Saksikan Hendap Ahad ini 9.30 malam hanya di Bernama News Channel.
Accurate, legitimate, and packed with information. First on site with reports from across the country and around the world. Be in the know through Bernama News Bulletins. Only on Bernama News Channel.
memaparkan isu semasa, pelancongan, warisan dan budaya dari dalam dan luar negara. Saksikan jurnal bernama News Channel, semuanya tentang anda.
Hello and welcome back to Medical Today. I'm Jared Ratnam. Of course, in the last segment, we learned a little bit about how medication or medicines moved around the country. Very interesting segment indeed from our friends at Pharmaniaga. We continue the show talking about dementia this time around. And joining me in the studio is Dr. Gunasundari Pushparasah, a consultant physician and neurologist from Ramsay Sime Darby Healthcare. Doctor, thank you very much for joining us. It's a pleasure to have you here. Well, today we're going to talk about something most of us fear that will afflict us when we're older, which is dementia. Now, to start this conversation on dementia, what is dementia?
So, most people would know dementia as memory loss, but dementia is more than just memory loss. So, memory loss only involves one domain of the brain. So, with dementia, you should have involvement of more than one areas of the brain. So, for example, you will have language difficulty as well, memory difficulty, then orientation. You may not know where things are. For example, in the house, where's the kitchen, where's the bathroom, where's the living room.
Right.
Okay, so it tends to involve more than one area of the brain.
But when you talk about that, there are lots of other problems that you're looking at also.
Yes.
One being brain tumor. You know, when you have a brain tumor, some people suffer, they become forgetful, they forget where they keep things. But we'll get into that later, because when you talk about disabilities around the world, how big a disability is this within the world?
Okay, if you talk about, you have two types of problems, you would say, diseases which cause death and diseases which cause disability. So, neurological diseases tend to cause a lot of disability. So, in terms of dementia, I would say that it's second only to stroke. So, stroke is still the largest cause of disability worldwide. So, when you get a stroke, you can't work, you can't move. So that's difficult for you. And the second most common cause of disability is actually dementia. So when you have memory loss, again, it's a difficulty for you, as in terms of working, as in terms of someone to take care of you, as in terms of planning your day-to-day activities. So disability-wise, yes, dementia, I would say, is pretty much up there.
Now, when we talk about the detection of dementia before the obvious symptoms appear, what are we looking at to detect the disability?
Okay, so a lot of people will say that they have some mild
is it
memory
a disability
loss.
or disease?
You could say it's a disease, but patients feel disabled by it. So
right. You'd rather term it a disability.
Yes, so for them, it's what is disabling them. So you have to go based on the patient's symptom and patient's age. So for example, if somebody who's younger, they might be just feeling the pressures of work and saying that they can't forget. It's more of a presence of mind issue for them. Whereas someone who's older complaining of memory problems, you need to take them seriously, because it's quite possible that they have early onset dementia setting in. So if they start saying, I can't remember, so they should be taken seriously and taken to the doctor.
So if I'm sitting in the office and I'm highly stressed, running from place to place, and I forget things down again, that's not a sign of dementia.
No, that's not a sign of dementia. So as you get older, for example, above the age of 70, so 10% of the population are supposed to be having memory problems setting in. And as the age goes up, so by the time you reach 80, so that goes up to about 25%.
Right.
And above 85, I would say more than 35% of the population will be having some form of memory loss. So it does tend to sort of go up quite steeply as you get older and older.
As with it is with all different diseases,
Yes.
the older you get, the more health checks you need now.
Yes, yeah.
You reach your 40th birthday, you do a set of tests. When you reach 50, when do you start thinking about screening for dementia? Is there a screening of sorts?
Well, it's based on the patient's complaints. So you can get dementia when you're younger too. I'm not denying it, you can. But commonly dementia sets in after 60. So after 60.
So when you say younger, what's
so you
what's
can
the
be in your
youngest
40s, you can be in your 50s.
Bad news there.
Yes, but those are generally genetic forms of dementia. So not the commonest variants. The commonest variant of dementia is still Alzheimer's. So which is due to what we call a protein deposition in the brain called tau and amyloid, the two different proteins which deposit in the brain, and this is what we call Alzheimer's disease. So younger people in their 40s, in their 50s, so they can also get, but that's more of a genetic dementia.
Right.
So whatever age they come in, we need to take it seriously.
Okay. When you do a bit of reading, you understand that there are different types of dementia.
Yes, yeah.
How do you break it down for us in the most simplest form?
Okay, so the commonest that we all know, it's Alzheimer's, so which is due to tau and this amyloid deposition in the brain.
Okay.
So there are abnormal proteins deposited in the brain. Then you have something known as vascular dementia. So vascular dementia, people who have diabetes, blood pressure, who get a lot of strokes. Now when you get a stroke, that also affects the brain function. So you can get dementia due to the fact that you're always getting strokes in the brain. Then you have different varieties like Lewy body dementia. So that's a different variety of dementia, but that looks a bit different. The person looks a little bit Parkinsonian, a little bit of shaking, a little bit of hallucinations, not quite normal one day and bizarre the next day, and then back to normal a day, so very fluctuating. So different types of dementia. So what I've mentioned so far, Alzheimer's still the commonest. Then you have vascular dementia. Then you have something like Lewy body dementia. Then you have all the other genetic forms of dementia which may set in when someone is younger.
Now let's talk about diagnosis of dementia or investigation. How would you as a neurologist come physician investigate and ascertain if a person has dementia or the different types of dementia?
Okay, so when people come and see me for memory problems, so there is a standardized testing that we do. So it's like a questionnaire with a certain number of questions. So we assess functions of different parts of the brain. So we assess their memory, we assess their language, then we assess their recall, then their orientation. Do they know what day it is, what time it is, what year it is? And we assess their ability to recognize and name things. So we are basically doing a quick screening of all the parts of the brain. So the brain has many different areas. So you have the front part of the brain, which is more important for planning and control. Then you have the back part of the brain, more important for vision. And then you have different parts of the brain for language and memory. So there is a quick screening that we do, which sort of gives you a bird's eye view on the brain function. Beyond that, we do things like MRI brain, so a screening test, a scanning of the brain, so that can show shrinkage of the brain. So when you're demented, the brain will look shrunken than what a normal person has.
What would you say is the gold standard of diagnosing dementia?
So okay, we don't have that in Malaysia just yet. So it tends to be more in research centers. So we have this amyloid and tau PET imaging, PET. So it's not an MRI, it's an imaging called PET. So that can pick up this amyloid deposition in the brain and tau deposition in the brain. Again, even in advanced countries like UK and US and Germany, they also don't do this for the general population. It's just more done as a research setting. So when you use this machine to pick up the amyloid and the tau, you can see early deposition. Now when you see the early deposition, at that stage the patient may not be demented. So you're just picking it up early, but the dementia may set on 10 or 20 years later. So the thing about dementia is it actually goes on for about 20 years until you have a symptom. So there's a very long window from the deposition of amyloid and tau to actually seeing the obvious effects of the dementia.
Right. We're going to take a break in a short while and come back talking about Alzheimer's. But for those of us who are in our 60s, early 60s, mid 60s, what would be your advice or tip with regards to making sure that you know your mental health and also your brain function health or your brain function? What can we do? They say there's exercises you can do.
Yes.
Keep yourself busy. Make sure you're doing puzzles, things like that. Keeping brain activity going. What would you advise?
So keeping brain activity going is actually very important. So they find that people with higher levels of education are actually to some extent protected against dementia. So in a child or in a younger person, it's quite easy. They go to school, so they keep studying, they keep learning. So how do you do that in the
your golden years?
In your golden years, yes. So the trick behind this is even any form of informal learning is also useful. So for example, you should pick up a new hobby. Don't do the same hobby again and again. Go and change hobbies. So that stimulates the brain to learn again. Or pick up a new sport.
Right.
Pick up a new sport. Okay, and then or pick up a foreign language,
Open
a different language.
New neural pathways. So to
Yes,
speak.
you're opening up new neural pathways in the brain. Or it can be as easy as trying a different food.
Right.
So that's stimulating the brain in a different way. So the trick is to keep the brain constantly, I wouldn't say constantly stimulated, but you need to rotate, not keep doing the same thing again and again.
Right. We're going to take a short break. When we come back after the break, we're going to delve into Alzheimer's. From dementia, we're going to delve into Alzheimer's. We're currently talking to Dr. Gunasundari Pushparasah, a consultant physician and neurologist from Ramsay Sime Darby Healthcare, right here on Medical Today BHC. Stay with us. We'll be back after this break.
Tak ada idea nak makan apa?
Panas, mari.
Tak tahu nak makan kat mana?
Wow, inilah pencuci mulut yang saya tunggu-tunggu ni.
Ada banyak kedai makan dengan 1001 menu yang saya boleh cadangkan.
Tengoklah. Dia punya sedap tu memang ada kelas lah.
Anda kenalah tonton Koleksi Tapak Apa setiap Selasa 4:30 petang.
Bunuh diri kerana dadah syabung. Ini anaknya lah ni. Sampai masuk suat khabar lagi. Memalukan kampung kita. Anak Mia ni.
Hei.
Betul lah.
Yang ambil dadah akulah, bukan mak akulah.
Kau tengok sendiri.
Hei, pekat!
Weh Siti, ayah kau mati sebab dadah kan?
Minggu depan, kalau kau nak bayar, lagi teruk daripada yang aku buat.
Siti takut. Siti jangan takut, Mama adik sayang.
Jangan biarkan keluarga anda menderita kerana dadah.
Laporan pelbagai dimensi. Memaparkan isu semasa, rancangan warisan dan budaya. Dari dalam dan luar negara. Saksikan jurnal bernama News Channel, semuanya tentang anda.
Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders. Monday, only on BNC. Hello and welcome back to Medical Today. We just discussed dementia a short while ago. With me in the studio still is Dr. Gunasundari Pushparasah, a consultant physician and neurologist from Ramsay Sime Darby Healthcare. Let's discuss Alzheimer's now. When we talk about Alzheimer's, where do we begin with this? What is different from Alzheimer's and dementia? Just so we're clear, you did mention it before. Just give us a run through of what it is again.
So dementia is a very broad term, covering many different types of memory loss, you would say, and Alzheimer's is the most common variant in that. Okay, and Alzheimer is actually due to, like I mentioned earlier, it's the amyloid and the tau deposition in the brain.
Right.
More than what it should be. So as you get older, more and more amyloid and tau will get deposited, causing the dementia.
Basically, you have stuff stuck to your brain.
That's right, that's right. So, okay, the thing about dementia that I would like people to know is, it takes 20 years to get it. So there's a very long window of opportunity for us to actually intervene. If you're going to get if something takes 20 years, so the window is quite wide for us to prevent it actually in that way. So some people are of course more predisposed than others. You know, so that's mainly the message I like to tell people, that it's not something that you develop overnight. It's not even 5 years, the window goes back to 20 years. So for example, if you're going to get dementia in your 60s, by right the process is starting in your 40s. So your lifestyle in your 40s is actually very important.
Right.
You know, you
so
can't
how you
decide.
live your life just past 40 is a very crucial time.
It's a very crucial time. So you can't say after 60 I'm going to start doing everything right. I'm going to enjoy maximum till I'm 60 and then I'm going to take a break, and no, because it starts setting in after, it takes 20 years. So if you logically think about it, what you do in your 40s is very important for you.
Right. So the risk factors, what do you think are the risk factors at this point?
Okay, so they have done some studies and they've discovered that there are some factors which are preventable, and to a certain extent, dementia can be prevented to a certain extent. There's also a genetic component to it. So what are the factors which I would say risk factors for dementia? So diabetes is one, blood pressure, if you're very overweight, obese, that's also a risk factor. If you're physically inactive, they found that exercise helps keep the brain cells young. So we all know about the effects of exercise in keeping your muscles young. You tend to look younger, you're more fit. It also has a role in keeping the brain cells young. So it's not just exercise for physical body, it's also exercise for the mind in that way. So you're basically, when you do exercise, it sort of increases the circulation and keeps the neurons in a better state. Then you have things like I said, education. So education is a very, very important factor. They found rates of dementia lower in more educated people, college educated, people with 1 degree, 2 degree, people who participate in lifelong learning have a lower chance of dementia than, let's say, if you finished after SPM and then just started working and never sort of went back to learning. But learning can be informal, like what I was saying earlier on. Just pick up a new hobby, pick up a new sport, pick up a new language, Travel is another factor which stimulates the mind, because no two roads are the same, no two shops are the same, no two buildings are the same.
So all the different things you do in life helps with
Yes,
brain activity.
forming new neural pathways. So that way education is very important. If you are forming new neural pathways
So when
in the
they
brain.
say a learning curve is lifelong,
So
there's a lot of truth.
There's a lot of truth to it, and we have also found that it protects you against dementia. So that's an added benefit.
Right.
You see, so and then hearing loss is another factor, risk factor for dementia. Now you may ask me, what has hearing loss got to do with dementia? So when you can hear, your brain is more stimulated. So again, it's a stimulation factor for the brain.
Right.
So if you're not hearing, you're actually not stimulating yourself. So the eyes and the ear, they are what get the input from the external world.
Right.
So if you have hearing loss, your brain is less stimulated compared to a normal person.
Let's talk about the advancement in treating dementia. How far have we come, say, in the last 10 years?
Okay, I won't say that the drugs that we have these days are, they don't cure dementia. They sort of slow down the progression only. So for example, if you're declining, your function is declining. So the drugs just slow down the progress. They won't reverse the function. But all said and done, there are trials going on overseas to look for a cure for dementia. So remember, dementia has a 20-year window. So they are trying to identify patients early and give them anti-amyloid therapy and see whether it works and stops the dementia from going on. But those are all under clinical trials right now.
Right. So it's still under trial. There's no published paper to say that they found something.
As a cure, no. A cure, no. There were some vaccine trials early on, but they didn't work and they failed. So the cure is still ongoing.
Right. Of course, in your area of speciality, it has its fair share of myths. A lot of snake oil sellers out there who will come and say, take this and take that and you will never develop dementia. Have you heard of any of these?
Well, yes and no, but I would say that none of it actually works. So you sort of need to realize that whatever they're selling to you, it's probably not going to work. So a lot of lifestyle factors involved. You know, so if you ask me, all the things that people tend to do, your diet's important, exercise is important, go for your regular health checkups, make sure you're not overweight, make sure you don't smoke. Smoking is another risk factor for dementia, you know, and then keep learning. Keep learning. The learning part is very important, and travel doesn't have to be overseas, you know. You can even go to another city, go to another shop, take a different road to work. That's also learning, because the road is different and you have to pay attention.
Right. So all these little things you do, breaking out of your routine will help you keep the neural pathways growing and of course keep you thinking a lot, which will help in evading or staying away from dementia.
Yes.
Right.
And there's another lifestyle factor that many people are not aware of. So it's not old wives' tale when people tell you to lead a healthy life. So for example, depression also can lead to dementia. Depression is also a risk factor. If you're socially isolated, you don't have friends, you don't mix, that's also a risk factor for dementia.
Right. Of course, I'm going to digress a little because you brought up depression. For people who are suffering from depression and who are on drugs for depression, say anxiolytics and the other SSRIs and SNRIs, are they at risk of developing dementia?
Not if they're taking medication, but if their depression goes untreated, then they could be at risk of getting dementia.
Right.
So depression by itself is a risk. So be happy or try to be happy, because depression is challenging. I mean, some people need medication, some people just need a change in attitude and change in expectations of what they expect out of life. And then social isolation.
Some people need to have expectations.
True. So social isolation as well. So you need to have friends, you need to have family, you need to have a network, or join an association that you're passionate about.
Right.
That form of connection and connectivity does stimulate the mind and ward off dementia too.
Right.
Okay, and sleep. I forgot to bring this up.
I think our takeaway from all this is to keep yourself busy at all times. Try to get, for as long as you're alive, do things or get things done.
So you need to be busy, not too busy, then your brain is overstimulated.
Yeah.
So imagine, just remember the lifelong learning that you need to do. Keep changing your hobbies every now and then. Keep changing your routine every now and then. That stimulates the brain, develops new neural pathways, and live a healthy lifestyle that prevents dementia. So smoking, avoid depression, don't be socially isolated, have friends, have family, have a network, and sleep well. Sleep is very important to prevent dementia.
With that, we'd like to thank Dr. Gunasundari Pushparasah, a consultant physician and neurologist from Ramsay Sime Darby Healthcare, walking us through dementia. Thank you very much, Doctor. It was a pleasure having you on the show.
Yeah, pleasure being
Stay
here.
with us. We're going to come back with more for you right here on Medical Today. We'll be back just after a break.
Anda ingin menjadi kaya, tetapi awas, terdapat banyak skim-skim pelaburan tidak sah di pasaran. Jika ragu-ragu, anda boleh jumpa kami untuk memahami formula TIPU. Apa itu TIPU? T. Tidak akan rugi. I. Indah khabar dari rupa. P. Peluang hanya sekali. U. Untung besar. Ingat dan berwaspada dengan formula TIPU ini. Untuk sebarang pertanyaan mengenai pasaran modal, anda boleh hubungi kami.
Anda sedang merancang untuk bercuti, jalan-jalan bersama keluarga? Saksikan program 1001 Destinasi Malaysia Ko untuk paparan percutian yang boleh membantu anda memilih destinasi bercuti bersama keluarga dan taulan. Setiap hari Khamis pada pukul 8.30 malam di Bernama News Channel. Semuanya tentang anda.
准、可靠、及时。马新社新闻台华语新闻，让您掌握全国与全球信息。
Hello Malaysia and welcome back to the final segment of Medical Today. We did talk about logistics and moving medication around. We also had, or rather received, an in-depth understanding on what dementia is. For now, let's talk about diabetes in Malaysia. What's the trend, the myth, and what's new? Joining me in the studio is Dr Foo Siew Hui. She is a consultant endocrinologist from Ramsay Sime Darby Healthcare. Doc, thank you very much for taking time off to be with us. Now, the current state of diabetes in Malaysia, apparently half of Malaysia has diabetes, or that's too exaggerated, but the numbers are quite out there.
Yeah.
What is the situation at this point?
So, I mean, current state of diabetes, I think probably people have been aware that we are definitely getting more and more people with diabetes with increasing prevalence. So the latest figure for information, we got it from the 2015 National Health Morbidity Survey. So which we sample the community age 18 and above, the current number stands at 17.5%. So what it means is that more than every 1 in 6 individual will be diabetic. So the problem that's worrying about this survey is that we found that out of this 17.5%, more than 9%, which is more than half of it, were actually undiagnosed.
Mm-hmm.
So meaning that, more than half the people don't even know they're diabetic.
Right.
So
but for the past
problem.
10 years, we've been running some pretty fantastic campaigns, awareness campaigns around the country. It's still falling on deaf ears, or are people in denial?
Right. So it now comes down to the issue of awareness, right? Is it all about awareness? I think partly yes, but partly no. Because I'm sure in the press, the media, we have done a lot of work on the awareness of diabetes, the World Diabetes Day, and people are actually aware. But so only unless you're out of this world, and But the problem is when you're aware, and do you actually get yourself screened? So there are a lot of campaigns, getting people to get themselves screened. But people often, the whole high-risk people mean, if you are have weight problem, if you have strong family history, they tend to run away from screening. And the people who come for screening are actually those who are very, they are health conscious,
Right.
They are physically fit, and they are not the one that
Basically, people don't want to know bad news.
Yes,
Yeah.
yes, and one of the mentality, because diabetes is asymptomatic disease, you don't feel it until the disease has got complication. So people tend to run away from their reality that, I don't want to know my numbers. I just do what I can do. That if I'm doing it, and they will only get themselves screened if there's really complications as in. Yeah.
Now, with regards to screening, the gold standard is still the HbA1c, isn't it? Is that the gold standard?
For screening?
Yeah.
Right. Actually, there was something recent. HbA1c, what it means is a laboratory test that tells you what is your sugar, average sugar in the last 3 months. So in the past, actually, it is not validated. But because of this problem that I was talking about, that people do not come for screening, the good thing about this HbA1c is when you do the blood test, you do not need to be fast, right? So that means that if you have a patient who come in to see you just for cough and cold, and the patient say, by the way, I would like to offer to check you for diabetes because you have weight problem. But the doctor, the patient will say, but I'm not fasted. No problem. I can do your A1C.
You can still do it.
Right. So that's called opportunistic screening. That's one of the reasons why we have recently validated HbA1c as a test that you can use it to diagnose diabetes.
Right. Are there better tests out there now? More accurate tests, so to speak?
I mean, there's no perfect test in this world. So in the past, I mean, if you follow the World Health Organization definition, there is there is conventionally we fast the patient, and we check their sugar, and there is also an option of challenge them with the glucose. We call it oral glucose challenge test,
Correct.
and then you check the sugar after challenge, right? So because these tests are not conducible in the sense that you can't, it doesn't allow you to do opportunistic screening because you have to fast and then you have to go through the challenge. So that's where A1C come in. It's not a perfect test, but it's got its values because of this one main thing is opportunistic, and also it's a test that you can even do, at there and then point of care, because nowadays we have machine where you can actually do it there and then you get the results immediately.
If you're predisposed to it, they say that I'm of Indian origin and I'm predisposed to diabetes, plus family history makes it worse for me. Now, with all this information at hand, the best I can do is lead a healthy lifestyle and take care of my sugars. Is that right, or is there more to that?
I think it's fine. I mean, if you know that you're predisposed, of course you try to engage the lifestyle that's as healthy as possible, and you get yourself screened. I would say once you reach a certain age, let's say, I would say if you're high risk, you probably should start screening at 30 or even consider earlier if you have a weight problem, and you get yourself screened every year. Right. And then because the thing about diabetes is if you get diagnosed early, it's very easy to treat. And you can remain stable for many, many years because you just get control. You just make sure it's very well controlled, and your disease doesn't progress. But as opposed to sometimes what we're seeing now, you come in with a sugar of 20, your disease will progress very fast because you came in already, your disease is very much established, as opposed to you come in with a mildly elevated sugar. So it's easier to intervene in the early stage.
Now, what do you think is the most worrying trend in Malaysia with regards to diabetes or the understanding of diabetes mellitus?
Right. What we have noticed is in the recent years is we are seeing more and more young people with diabetes. I mean, what we talk about is the type 2 diabetes, not those, the type 1 diabetes, which is a separate topic. So type 2 diabetes related to lifestyle, related to obesity. So we are seeing more and more. So every now and then you see people turn up to you and, I'm only 16, why am I getting diabetes? But you see that. So
but
that's
everyone
very, very
by and large blames it on the food we eat right now. We've sort of embraced the fast food culture, and is that a contributing factor or one of the main factors as to why this is prevalent?
So among these young people with diabetes, yes, definitely one of the factors is because of this environment that we have now. We call it obesogenic. So because lifestyle, we have very high, the food that we have is very energy dense. So healthy lifestyle, people have obesity, weight gain. That's one of it, but that doesn't explain all. The other problem that we are seeing is, as opposed to this, people are getting diabetes younger. Now we are also seeing young women who are of the childbearing age. Before they get pregnant, they are already diabetic, or sometimes they get diabetes during pregnancy, what we call gestational diabetes.
And that's very prevalent too these days.
Yeah, so we are seeing more and more. And not all the time, in fact, most of the time, the sugar is not that well controlled before they conceive. And automatically, so all these babies, fetus we call medically, so when they conceive in the environment when the sugar is high, so this environment is very unfavorable. So what happens is when this baby was born and they grow up, so they are automatically predisposed to getting diabetes at a very young age. So this got nothing to do with the gene. This is because of the very unfavorable uterine environment, which make them program in such a way that they will be predisposed to diabetes at a very young age. Even if, they just have to be a little bit chubby, and they don't have to be overtly obese, then they will get it. So that's another reason as well.
Right. And before we talk about the latest developments, and there have been a lot of promising stories about insulin now. They have coming up with insulin patches, so on and so forth. But before we get to that, let's talk about the common myths and misconceptions. A little area I like very much, because I listen to a lot of my friends talk about how they can reverse diabetes and how boiling certain plants will help you, and how Big Pharma is trying to, squeeze the common man and take his money. But a lot of people are just going out there and selling all these supplements that don't work. Yeah.
So, I mean, from the layman point of view, I mean, in general, people like to listen, oh, this pill, this is natural, it's called natural herbal product, will make your diabetes disappear.
Must cure, yeah.
That is very appealing. This is called about marketing strategy, right? So I mean, as a layman, you don't, I mean, you're not a scientist, you're not a medical, you don't look at the evidence behind it. Oh, this sounds very appealing to me. Then I will forget about the pills from my doctor and I'll just take this natural. It's just, people liked it.
Or your best friend will come to you and say, forget about what your doctor has given you. Take this.
My diabetes will disappear. I don't have to see my doctor every 2-3 months. So that was a misconception. I mean, of course, I mean, nowadays, yes, diabetes in certain situations, it can be reversed, but not with this sort of thing, you know. I mean, of course, if you have...
But when you say it can be reversed, which means you can be going back to the lifestyle, the unhealthy lifestyle you had, that can't happen, isn't it?
No, what I mean is that if this is a certain condition that tied with it, if your diabetes is very much newly diagnosed and your sugar is just mildly elevated, and then you go on to this very intensive lifestyle, meaning that, you know, your diabetes is, you just get detected after this glucose challenge test, but you just passed the cutoff point of 11.1. So there is a chance that if you have an active lifestyle, you know, you lose a lot of weight. A lot of time, like if you have a lot of excess weight, you lose a lot of weight, you can potentially reverse. That's where it comes, you know, we talk about bariatric surgery.
Right.
So sometimes you see, you know, you're like 150 kilo and your sugar is 7.1. Of course your sugar is 7.1, but you're 150 kilos, so you shed that weight, likelihood your diabetes get reversed.
If that word caught you bariatric surgery, we did talk about that a few weeks ago in order to help with the NCDs, right? So there's a lot of developments in the fight against diabetes, you know, or to kind of reach out to people with diabetes and help them with treatment. Now, what's the latest development in terms of treatment?
Okay, in terms of treatment, yeah, I mean, medication, certainly there's a lot of development. So in the past, 20 years ago, we only have insulin and 1 or 2 oral drugs. Nowadays, we have globally, we have up to 10 classes, different types of medication. So what happened in the past few years is that this newer drug that is being developed for diabetes has there's very high, they have achieved very high standard. What it means is that on top of controlling your sugar, they tend to be friendly towards other aspects of your health, like they help you to reduce blood pressure. We know that most diabetes have high blood pressure. They may potentially help you to lose weight as well, as opposed to when you take some other older generation, it's actually gain weight. And also they even may protect your kidney and your heart.
Pairing drugs now.
Yeah, so this is a later generation of the drug when they were trying to prove that. In fact, some of the agents have actually proved it. The other thing, of course, we talk about surgery is also one of the options. The third option is, of course, we talk about technology as well. So the technology is also coming in when you have a different way of administering insulin, the pump, and then the pump can auto-suspend if you have hypoglycemia, meaning you have low blood sugar, and then you have gadgets with monitoring, when you have flash glucose monitoring. So there's a lot of technology involved. So it depends on what kind of lifestyle you want. Yeah.
Right. With that, before I let you go, we've got about 30 seconds left. What is the future direction or goals for diabetes within Malaysia?
Okay, so definitely one of the most important things we need to do is to prevent diabetes, and that has to start at a very young age. We need to prevent childhood obesity, and in order to prevent this epidemics of young people getting diabetes, because if you get diabetes very young, it's going to place a very heavy burden on the country, you know, in terms of the socio-economic, you know, you will lose your ability to work. So that comes back to public health where we, one thing, apart from awareness, I think we need to have this, to make healthy food more accessible, subsidized, like, you know, subsidized vegetables, fresh food. We know sometimes fresh food is not that cheap. And sugar, I mean there was recent controversy.
It doesn't need to be subsidized.
Yeah.
That's my personal opinion.
Yes, because if you look at Western countries, not only is not subsidized, there is a sugar tax.
Right.
So, I mean, people are easy. No, sugar and condensed milk is very cheap. So if you have restricted, you have financial constraint, you will tend to go to the refined, refined, unhealthy food, then that is unfortunately is going to make your problem worse. It add up to the healthcare cost.
So that's a little something we should look at.
Yeah.
Subsidies for sugar and whatever that comes along with it. On that note, we'd like to thank Dr Foo Siew Hui, a consultant endocrinologist, from Ramsay Sime Darby Healthcare, joining us right here on Medical Today to talk about diabetes and that problem in Malaysia. In the meantime, if you do have questions for us and if you want to forward questions to our medical practitioners on the show to get some answers, send your questions to ask@medicaltoday.my, that's ASK, and medicaltoday.my. And when you send your questions in, we're not only going to send you your answers, what we're going to do is furnish you with a bottle of vitamins courtesy of Pharmaniaga right here on Medical Today, only on BNC. Have a great weekend and a fantastic week ahead. I'm Jared Ratnam signing off. Take care and bye-bye.